Absolutely, we've given that guarantee to the Minister. We are required to present that information very clearly, particularly in things like prosthesis, so that it's completely open book. So absolutely, I give a guarantee that where the Minister has made savings, like prosthesis, we will be passing them on 100% to consumers. Well, it's a good range of very supportive reforms from our Minister of Health. I think obviously health insurance and the cost of healthcare is facing some big affordability challenges at the moment. So this is a great first start to move in a direction which will help make the system more sustainable. We know over the last couple of years that younger people have not been joining health insurance like they did in the past, so I think we need to obviously look at how we make health insurance more relevant, but clearly a discount is an important part of that. We've yet to work out some of the details, but if we can offer something very tangible to younger people if they join before the age of 30 and give them perhaps a head start, a hand up, that'll be great, and I'm sure it'll be very welcomed by younger people. Well, the Minister's had a very interesting negotiation with the medical device industry, and he seems to have got a pretty good deal for customers. So at the moment we think it's of the order of 180 million approximately. In simple English that means between 0.8 and 0.9% off the price of the next rate rise in February, compared to what it would have been. So fantastic win for customers, and obviously as the health insurance industry we're delighted that we're now starting to chip away at some of these very expensive world prices we've been paying, and it's very meaningful for customers when we go out in February. Well, mental health is a very important issue obviously to many Australians. I think the Minister's first step of getting a safety net. In other words, if you can upgrade your policy, there's no waiting list, waiting time to get into inpatient mental health if you need it. But as we know, community mental health is really where we need to develop more options for people. So access to psychiatrists in the community, access to therapists, a range of digital support, all of those things are possible. The Working Party will enable us really to figure out how we can develop a lot of these services in the private sector to support people with mental health conditions. Well, Gold, Silver, Bronze is all about making it easier for customers to know whether they're comparing like products. So as long as it wasn't going to be a bureaucratic nightmare, and I think we've found the sensible balance here. People need to know if they're kind of at the budget basic end or at the top gold end, and I think that's great. I think the fear has always been that the budget or bronze end of the market, that people would try and make that too expensive by adding a whole lot of stuff in. Again, I think the Minister's found a very pragmatic balance here. We've got products hopefully with good general cover, but they're not going to raise the price of these products to the point where we'd lose people out of health insurance. So I think we've come to a very sensible end here on this one. Well, I think as a health insurer we have had a pretty steady, what we call net margin over the last few years. So we're not trying to raise our net margin, which is typically between 6 and 7 cents in the dollar. A lot of our effort has gone into making it easier to deal with us as a health insurer and trying to get more effective healthcare for our customers, whether that's to do with their health and well-being or when they have to interface with doctors and hospitals. So we are trying, at the end of the day we want more people to have health insurance. So we're looking to reinvest all of the savings that we get, particularly like prosthesis, back to the consumer directly.